All right. So, hello. My name is Raynard Riley. I'm a general dentist in Summit, New Jersey. The name of my practice is Patient First Dentistry of Summit, and I've talked with a few videos in the past, and a lot of times people ask me questions, and right now there have been a lot of medical discoveries and links between gum disease and heart disease and things of that nature. And I'm starting to run into a lot of people who are asking me questions. The question that they ask is, does gum disease really affect the body? Now, I'm just going to repeat what I said earlier. I'll just start over. Basically, let's talk about heart disease. There have been studies that the common links between heart disease, heart attacks, is the risk factors. The main risk factors are smoking, obesity, and high cholesterol. But there's a pretty large segment of people who have suffered heart attacks who don't fit into that category at all. And they're starting to discover that one of the common links between heart disease is inflammation, chronic inflammation. And that's the link between gum disease and heart disease. For example, gum disease, periodontal disease, is a chronic infection of the gums. And the link between this is there's an actual enzyme inside of the body that builds up due to chronic infection and inflammation. This enzyme is called the C-reactive protein. And they have found that people or individuals that have elevated levels of the C-reactive protein are at risk for heart disease and heart attack. So that's one link between gum disease and heart disease. It's also been found that individuals who have gum disease, and we'll talk about women, pregnant women have shown to, in some cases, who have severe gum disease, have given birth to low-weight babies or preterm babies, given birth to babies early due to gum disease. There have been links between gum disease and osteoporosis, and there have been links between gum disease and diabetes. It has been shown that chronic inflammation reduces the body's capacity to process and use insulin properly. So individuals who are type 2 diabetics who already have a decreased capacity of processing sugar in their blood also have a reduced capacity to processing the sugar in their blood because of the chronic inflammation which they may have from gum disease. So in a lot of cases, when you have gum disease, it can exacerbate other bodily functions inside of the body in terms of diabetes, heart disease, osteoporosis, rheumatoid arthritis, just to name a few. So having said all of that, gum disease does impact and affect the rest of the body, and it's something that you don't want to take lightly. It's a chronic infection. It needs to be handled. And if you have any other questions or any other inquiries, you can always go to patientfirstdentistry.com and see if you can find any more information on that. Thank you.